that's the question. A lot of people have that concern that there's somehow now a genetic marker because of the vaccine. And I think the other thing is if you look in total, and I think the Operation Warp Speed, the idea that, look, we need to move with a sense of urgency, maybe not at the pace that government is historically not very effective at, seemed appealing up front, but now with the benefit of hindsight, could we assess that Warp Speed was successful or not?
In my opinion, what we've learned, remember it's now 4 years. In my opinion, what we've learned is that the collective wisdom of decades of regulatory science as it relates to vaccines and other medical products was appropriate. There is a reason why these products typically require up to a decade to be proven to be safe and effective. And it was not prudent and not in the interests of protecting the citizens of the United States or the world to bypass those time-tested processes that have basically been agreed upon through various forms of informal international treaties in order to, my words are, jam a product through a process in order to get it out to respond to a false threat. Remember, the underlying thesis here is that we had 3.4% case fatality rate. This was told to us again and again and again, and it was a lie.
Dr. Biss, I'd like to talk with you for a few minutes. Reading your resume here, and it's quite impressive. You're a certified OBGYN. You serve on many committees, even being chairman of the OBGYN department. And you're here on your own, out of your own capacity. You've been involved with about 8,000 pregnancies. That's a lot of babies. That's a lot of women. So I'm very impressed with your expertise. I want to talk to you a little bit. I've read so many reports and heard so many women that were vaccinated talk about issues they had with menstrual cycles, pregnancies. So I just have a few questions about this. How many of your patients did you see have increases in menstrual cycles, menstrual hemorrhages, all kinds of issues after receiving the COVID-19 vaccine? And were there clear changes for them?
Yeah, I don't have data for that. I wasn't tabulating that. Dr. James Thorpe has published many.
I have a little data.
And that's data from the VAERS, yes. Dr. Thorpe has published several articles in the last few years showing that there were definitely changes in women's menstrual cycles and also in postmenopausal patients. So those are women that have gone through the menopause and started bleeding for no structural reason, no tumors and whatnot. What was of grave concern too in these reproductive age women is a lot of them were having what's called passing a decidual cast, which is where normally a menstrual period will last 5 or 6 days. Imagine if you have your 5 or 6 day menstrual period all combined into an hour where your entire lining of your uterine cavity is shed all at once. It's very painful. It causes hemorrhaging. Prior to the injections, I don't call them vaccines, there were 40 case reports of this event in our literature. Dr. Thorpe published almost 300 women that this had happened to. And what's really of concern is not all of those women were vaccinated, but they had been around other people who had been vaccinated. So isn't that interesting? So yes, I've seen in my practice an increase. I've had to do surgery on patients that we just couldn't manage their bleeding, with the traditional hormonal methods and whatnot. And I've had to do hysterectomies on some of those patients as well.
That is so sad. Mm-hmm. You mentioned menopause. Of course, we know menopause comes later in life for women. Were these women, what age women were experiencing menopause after receiving the vaccines?
So, it varies as far as experienced bleeding in the menopause or went through menopause. The normal age of menopause is in the early 50s. The age range that's considered normal is anywhere between 45 and 55. There were some women who received these injections and went through what's called premature ovarian failure, which is early menopause. Usually that's classified prior to the age of 40.
Jeez.
A woman from France contacted me. She was a secretary in a gynecology office, and she said it was interesting to them because they had been tracking this, and it depended on where in the menstrual cycle the woman was when she received the injections. And if she was in the post-ovulatory phase and received the injections, those women were more likely to develop amenorrhea, which is lack of menses or go into premature ovarian failure. If they had received them early in the menstrual cycle, they were the ones that had the abnormal bleeding, the change in their bleeding pattern. So that was pretty interesting. They had a small case, cohort of patients, but I found that a little interesting.
How many of your patients or pregnant women that you know of experience miscarriages after taking the COVID-19 vaccines or injections?
Yeah, so a lot of that was hard I will tell you that I looked at my pregnancy population in the fall of last year, everybody that was pregnant in our practice, and our vaccination rate in that patient population was about 60%. That's pretty commensurate with Florida because last I checked in the CDC site, the vaccination rate in Florida overall was about 65 to 70%. Mm-hmm. Most of our pregnant patients received 3 injections. Very few received 4 or more. And what's concerning is the majority of the patients received their injections in 2021 and early 2022. Mm-hmm. However, we're still seeing lingering effects. I have a great Substack that Jessica Rose published in November of 2022, which shows my data in pictorial form. That's pretty right there behind you. So I went back to January of 2020, and this data went up to the beginning of November of 2022. I will tell you in 2020, we had very many newly registered obstetric patients, which is what the blue bars represent. Those are first trimester newly pregnant patients. We had the most deliveries we've had, and probably wink, wink, that was due to the lockdowns. We did also have what was considered the normal pregnancy loss rate. Now, what's quoted in my obstetric textbook and in some articles is that a normal miscarriage rate is 13 to 15%. I've never seen that clinically. There was a study that came out in 2020 by a gentleman named Naert, N-A-E-R-T, et al., that showed the actual miscarriage rate in the first trimester is 5 to 6%. And even that's a little high from what I've seen. My average miscarriage rate in 2020 month to month was 4%. That was normal. I had done a video where I wrongly said that my miscarriage rate had increased by 50% because I was put on the spot and I didn't have my data in front of me. I was wrong. My miscarriage rate from year to year went up 100%. In 2021, the average miscarriage rate month to month was 7 to 8%. We peaked in November of that year for some reason. That's actually when a non-clinical staff member came up to me and said, Dr. Biss, do you realize we've had 8 miscarriages this month, which in a practice that delivers 20 to 25 patients, that's a huge number. In 2022, the average month-to-month rate was 15%. Now, that was up till November. I will tell you in December, I've never seen this before. We had 41 newly registered patients. 13 of them lost their babies, so that's 25% right there. And then in January and February of 2023, it still remained high. Didn't normalize until June of this year, then went up a little bit and came down in September. So we're still seeing effects. You asked how many patients had the vaccine and then lost their babies. That's hard to determine. I mean, I can tell you 60% of my patients got vaccinated. But the problem is if they're brand new to the practice, I haven't seen them yet because I'm the only person in my practice that asks every patient, have you gotten a vaccine? How many? Which brand? When? Have you had COVID? How many times? Because whether we like it or not, that's part of your medical history now. I'm the only one that asks those questions. So the problem is if a woman miscarries and you ask them, well, did you get an injection? you may come across accusatory to that person. So that's information. You don't want to ever make a woman feel like she caused her baby to not be born. So it's hard to get the exact data in all those patients.
Of course.
Mm-hmm.
Do you find a correlation with miscarriages and certain vaccines, whether it's Pfizer, Moderna, Johnson & Johnson?
Yeah, that's a good question. I mean, the majority of our patients got Pfizer.
Mm-hmm.
The majority was Pfizer. I don't have that breakdown as far as the percentage.
Okay,
Mhm.
thank you.
A reasonable person watching this hearing might wonder why this is a field hearing being chaired by Congresswoman Greene rather than a hearing held by the House or the Senate with one of our standing committees. And I believe that reason is because far too many members of those committees obtain those committee seats because they are bought and paid for by Big Pharma. And if you go look at the people who lead these positions in the House and Senate and you line up the money they get from Big Pharma lobbyists and Big Pharma PACs, it is pretty easy to see why we are here. So I believe that we are just at the beginning of following up on these 60 oversight requests sent by Senator Johnson. And that is what our committees ought to be doing. They should be going line by line through the requests that Senator Johnson and others have laid out, and we should be answering those questions. And it's deeply frustrating, although I'm very grateful to Congresswoman Greene for leading this, it is indicative of how high the hill is for us to climb to get the truth out. Dr. Malone, one of my grave concerns is that all of the vaccine injured may not know that they are in the class of the vaccine injured because people get blood clots and pulmonary embolisms, probably because of the vaccine, but also probably for other reasons as well. And Dr. Biss, when we look at these tragic consequences of pregnancy, they can at times occur in the absence of vaccine. So what advice would you give us as policymakers to try to really disaggregate the symptoms of vaccine injury and those consequences from those that may have occurred otherwise?
Thank you, Mr. Gates, for your informed question. You are correct in saying that it is an enormous challenge. Just as the virus disease itself largely overlaps with what's called the common cold now in terms of symptoms, and it's very difficult to distinguish. Likewise, these clusters of symptoms are very difficult to distinguish from background noise in some cases. That's the job of the CDC, by the way, is to provide that type of analysis objectively in a nonpartisan fashion. And as even the New York Times has acknowledged, the CDC has become a partisan political operation. So we are left in the absence of reliable data by a federal agency tasked to provide that data to allow the discernment of your question. And the way that this would normally be done is to look for clusters of symptoms that correlate with a known disease or toxicity, and then identify patients who have those clusters. Practicing physicians currently, even those that aren't subject to the many professional and financial disincentives to be open and transparent about these things that you're mentioning, I'm choosing my words, are subjected to an enormous amount of not only propaganda or psyops, as has the entire public been subjected to it, but also enormous numbers of disincentives to disclose adverse events and disclose what might appear to be vaccine-related problems.
I hate to interrupt you, but that should be illegal. It should be illegal if someone is engaged in the practice of medicine or in the highly regulated pharmaceutical industry for people to try to disincentivize access to the information. And it's easy for us to blame the CDC, but frankly, they in a way work for us because we're the ones that authorize the funds for the things that they do and don't do. And so, I think that one of the things we got to work on probably is legislation that directs them to those data, to those clusters, and that then disallows the corrupt activities that you seem to be highlighting.
So, Mr. Gates, I've been advised that technically it is already illegal. these physicians have signed agreements, and their healthcare systems have signed agreements that they are obligated technically to disclose vaccine-related adverse events to the VAERS system. And that disclosure is being actively, let's say gently, disincentivized. There is strong consequences being deployed in medical practices and hospitalist environments to disclosing adverse events. And yet, technically, it is fraud. They have signed agreements with the federal government that they will disclose these things through the VAERS system. So my understanding from attorneys that are busy practicing in this area, which is a small number, maybe 200 right now in the United States, because that's a whole nother thing, is that a strong case can be made that this does represent medical fraud in the failure to disclose these events. And I'm in touch with some federal investigators who share with me that there's a number of things here in which aspects of this response in which federal employees and agencies have failed to comply with federal law in many aspects. You know, the notorious one being the revolving door, and the two FDA employees that oversaw the Moderna authorization then immediately left to take six-figure jobs with Moderna. But there's many examples of what appears to have been fraud or law breaking occurring within the federal administrative state that is not, these individuals are not being held accountable because there aren't the oversight structures, ombudsman, or other processes to enforce the law.
Yeah, even when we catch them. By the way, I'm holding the Inspector General report from DOD, where the Inspector General said that there was not the itemized review of people's religious exemptions that the law requires. So if we're going to keep funding it, it's going to keep happening. And I think the message to us is that we have to use the power of the purse. I don't have any other questions, but if Dr. Biss, if you had anything to contribute regarding how to kind of disaggregate these symptoms, I'd love to hear your perspective before.
Well, I would love to give you an example that just happened to me this week that kind of shows what's happening down in the trenches with the physicians. I had a patient come see me. She's 47, healthy, because her husband works as a civilian in a military base in Germany. She had to get to Moderna. And then when she came back to the States, she had to get a booster. She had Pfizer, so she had 3 shots in aggregate. Her last injection was in January of 2022, so it's been a while. For some reason, with no antecedent event, she didn't break a limb, she didn't have surgery, she wasn't sitting on a plane for 12 hours. She developed bilateral lower extremity blood clots, one of which broke off and caused a pulmonary embolism. She survived, but she was in the hospital for quite some time, had a huge workup. So bottom line is she has 5 specialists now on her case for all her problems. She comes to see me for her annual exam. And she's telling me this story, and I said to her, "Did you get any of these messenger RNA injections?" And she looked at me and she said, "You're the first doctor that's ever asked me that." ER physician, hematologist, rheumatologist, I don't know who else is on her case. I'm just an OBGYN. I can't help her with any of her problems. I said, "Well, you need to go to the hematologist, and this is what this hematologist needs to order on you, please." But this is what we're up against. They're not asking the question. So how are you gonna tabulate any of this? Nobody's connecting the dots.
I would just finally observe, we're only aware of the vaccine injuries where essentially people are so hyper aware of the connection between these things that they almost self-identify, because we have this infrastructure that disincentivizes it. And we fund this system. It is federal money that funds healthcare in this country, and we simply should not tolerate that. Thank you so much for filling this leadership vacuum. I yield back.